Kick it.
Hi, I'm Karen. Welcome to my kitchen. Today's backwards day, which means we're starting with dessert first, but with a healthy twist. Now, there has been no organization more dedicated to healthy eating than the American Diabetes Association. And here to help us understand why it's so important to eat healthy is Dr. Bonner, the president of the local Leadership Council of the American Diabetes Association. Dr. Bonner, welcome to the kitchen.
Thank you. Happy to be here.
Well, I am thrilled to have you here, and I have so many questions for you. But first, I want to start cooking, and we are making a delicious apple crisp. And I got the recipe, by the way, from diabetesfoodhub.org. And this is a delicious dessert, and you don't really think about having desserts when you have diabetes. You think, oh, I've got to cut out everything sweet. But we are here to tell you that that's not the case. So we are going to start by chopping some apples. I've got just about 5 or 6 red apples. So they can be Gala or Macintosh, that's fine. And I'm going to go ahead and slice these up while I ask you some questions. Now, it seems like you hear so much more about people having diabetes these days than you used to. Is that the case?
Absolutely. Diabetes is far more prevalent now than it has been in previous years, largely due to the obesity epidemic. Diabetes is both a lifestyle disease and a genetic disease. And the lifestyle that contributes most towards the prevalence of diabetes is obesity.
And why do you think we have this obesity epidemic?
Largely because people choose to eat those kinds of foods, particularly high in sugar and fats, that contribute to obesity, and also that we don't get the kind of exercise that we used to get.
What are some of the tips that you would give to someone as far as trying to plan their lifestyle if they've just been diagnosed? Because that's a hard thing to hear.
The management of diabetes for the newly diagnosed diabetic really revolves around 3 things. Number 1 is diet. Number 2 is exercise. Number 3 is medication. But clearly, lifestyle changes, not just a diet, but a lifestyle change involving the foods that the individual eats, the amount of exercise that they get, along with the medication, are all equally important.
Now, is there a way based on your diet, you can prevent diabetes?
Absolutely. We know that there are about 90 million people in this country that have pre-diabetes. That is, their blood sugars are higher than normal, but not high enough to be classified as diabetes. This group of people are the ones for whom dietary changes will have the greatest benefit. These people can reverse the onset of diabetes and prevent the complications associated with diabetes simply by lifestyle changes without medication.
See, that is fantastic. And a lot of people will think, well, you know, it's so expensive to be healthy, but it's a lot less expensive to eat healthy than it is to have medical visits all of the time.
Right, and the complications associated with diabetes, which are very, very serious.
Absolutely. So a lot of people think they have to have really fancy equipment when they're in the kitchen, and you really, you need your knife, your hands. But for coring apples, you want to get those apple cores. Sometimes if you don't have one or you don't feel like running out and buying one, you can just use your knife. It's really simple. Cut your apple into quarters like this one, and then you just cut on an angle, and you can cut the core right out of there. So it's going to save you a lot of time, it's going to save you money, and then you can go ahead and slice up your apple. And the recipe calls for 5 cups of sliced apples. Depending on the size of your apple, that might be 4, that might be 6. So I've got about 5 cups of apples chopped here. It didn't take long at all. And what I love about this recipe, and most of the recipes I've seen on the website, they're really fast and really simple, and they're really pretty. So I will absolutely make a lot of them for my family, even though fortunately none of us have to worry about diabetes. I have greased a 9x13 pan, and I'm just gonna put these apples, I'm not gonna put any seasonings or anything on the apples. They're gonna get all that from the topping. I'm just gonna spread those in here. And then I'll make the topping, and it's super easy too. And it's very simple. What I like about it is it has oatmeal, which is a whole grain. So that's good for you too. And it also has iron and all kinds of great stuff. So I've got half a cup of oatmeal. And this is easy, just dump it all in there. Got some brown sugar, a little bit of flour, about a 1/4 cup. And I'm gonna add my spices. And if it's fall, this is perfect because you're using these fresh apples and you've got cinnamon and nutmeg, and it's really gonna make your house smell good when you're cooking. You don't feel guilty at all when you eat it. That's the best part. And then I've got some vanilla, and here I've got 2 tablespoons of margarine. So I'm assuming that margarine is a better option than butter.
Absolutely.
When you're trying to watch your calories and your fat. I'm just gonna dump it in here. I'm gonna get a little messy and use my hands now. They're such a good tool, and you can really feel kind of how you're dispersing this. You wanna mix in the oats and the butter and the cinnamon and the nutmeg all together. And the best way to tell if it's really incorporated is kind of using your hands and going by feel. Gets a little messy though, but don't be afraid to get messy. It's great for if you want to cook with your kids too. They love to get messy in the kitchen, or just in general, right?
Yes.
I know mine does. Whew. So that's about it. So you see how easy this is. You don't have to have any sort of great chef skills. Just slice up some apples, play with your food a little bit. And then I'm gonna take this crisp top and pour it right over the tops of the apples. Meanwhile, I've preheated my oven to 375 degrees, and it's gonna cook for about 30 minutes. You can always check by sticking a fork into one of the apples to make sure it's done. And now all we're gonna do is pour this on top, and you really wanna make sure that you spread it out evenly. I don't know if you can smell that, but I can smell just the nutmeg and the cinnamon already. And once the apples start baking and the juices start flowing, it really fills up your house. And I understand November is Diabetes Awareness Month?
Yes, it is. It's National Diabetes Awareness Month, and it's for this reason that we want to focus the attention of the public on this very significant and dreaded public health problem involving 30 million people and having serious complications, all of which can be avoided by appropriately managing the diabetes. The blindness, the heart disease, the kidney failure, the loss of limbs, all these dreaded complications really can be avoided if people, number 1, know that they have the disease, number 2, manage it appropriately.
And you have to be your own self-advocate.
Absolutely.
You've got to take care of yourself.
Yes.
I'm gonna pop this into the oven, and in the meantime, I actually made one ahead of time, and it smells like it's ready. So let me set this over here. Doesn't that smell delicious?
It smells delicious.
Oh my gosh, I can't wait to try it. You can have this for dessert, you can have it for breakfast. It's got apples and oatmeal, it's perfectly healthy. So doctor, if someone or an organization wanted to engage more with the American Diabetes Association, how would they do that?
They can go to our website, diabetes.org, and all the information about diabetes and working with us, volunteering with us, information for patients and families is all in that one website.
Great, make sure you check it out because this is really important stuff.
Diabetes.org.
Diabetes.org. Thank you so much, doctor,
My
for
pleasure.
coming and hanging out with me in the kitchen today.
Thank you, I've enjoyed it.
Don't go anywhere. Now that we've got dessert done, when we come back, we are continuing with a dinner that's going to surprise you.